I'm Colonel Shari Silverman. I'm the medical group commander here, and we're excited to have you all here, and especially the first timers, because we think this is a very good forum that we can provide information to you, but just as importantly, we want to hear from you because patient feedback is really important to us, because we can't, when we traipse through the facility many times, you know, some things we just don't see anymore, and so we rely on you to provide us some information, and there's lots of ways that you can provide us some information. And so I think we've got some exciting topics. We try to gear this, again, information for you, things that we've changed within the facility, some changes, some things that are going on, upcoming events, and things that really impact you, your health care as our patient. All right, so next slide. Okay, so a couple things that I want to, you can see our topics. I'm gonna talk a couple more things, and then we're gonna talk about family health and some of the initiatives that they're going through. So those of you enrolled in family health may have noticed some changes, and Colonel Guest is going to speak about that. Obviously, Tricare benefits is always something we try to hit in these town halls because that's changing. Many of you know we've changed contractors, and we can address some of those issues. And pharmacy. Pharmacy is always, when we look at our patient feedback, I know pharmacy is always a concern. You see the building going up, the new one going up, and so we'll give you some updates on that. So next slide. All right, so next, I've already introduced myself. There's our mission, our vision. Like I said, we're real dedicated to making sure that we provide you the best health care that we can. All right, next. All right, so a couple things that I want to talk about. Some of the things more I need some help for you. Some of the things we already know that we've gotten some feedback on, and we've tried to do some changes. So first of all, for appointments, we need your help. All right, so for appointments, what we ask is that everybody show up to their appointments on time, and actually we would like you to be here 15 minutes early, because a lot of times when you come to your appointment, we're asking you to fill out some information for us, and so that at your appointment time, when it comes to your appointment time, we're going to make every effort to get you back on your scheduled appointment time. Now, I know that doesn't always happen, because what happens is I ask my providers to make sure they're addressing your health care needs, and that may not happen in that 15-minute or that allotted appointment time. So please be patient if they're not seeing you exactly on time, because they're probably taking care of somebody right before you, and that may drive them to be a little bit later for you. But at the end of the day, I want to make sure they're addressing their health care needs. But if you're on time, then that helps the day flows, because if you're a few minutes late and the next person's a few minutes late, you can see how that snowballs throughout the day and gets our providers a little bit behind their schedule, because they do have a very tight schedule. Again, because we're trying to make sure we have enough appointments available to meet your healthcare needs. All right, so we have that. Weather ops, I want to address that because that probably impacted some of you this winter. We had a pretty particular bad winter and we're not done with it yet. I heard that we're going to get snow again on Monday night, but hopefully it doesn't impact the base. So anytime the base is closed, this med center remains open. However, I want you all, my staff needs to stay safe, you all need to stay safe. So if you have an appointment that day and you feel like, hey, I don't think I should be driving in, please call us and let us know. We're happy to accommodate it. Some of our clinics actually reached out to you and said, hey, the weather's going to turn bad this afternoon. Do you mind coming in early? But if we don't have that contact information for you, we may not be able to get a hold of you. The other piece is, I know there were some hiccups with the weather this year, because the base, I know at the front gate, they turned some of our patients away. As soon as we found that out, we quickly backtracked and got that all squared away. So I apologize if you were any of those people that were trying to get in the front gate and security forces said, I'm sorry, the base is closed. I think we've got all that smoothed out. That no, the base may be closed, but the med center is open, because we have to make sure we see our patients. The only other thing I think with that is, I was going to say one more thing. I'll come back to it because I've lost my train of thought for the weather. But yes, like I said, we are closed, but again, that communication. Oh, the other piece that I was going to talk is the appointment line. We recognize that when we are open for weather ops, our contract for our appointment line says that they do not come in. So we're working through that so that next year when we have the weather, that we're all squared away, and so that they can come in and support you, because if you're trying to call in to reschedule your appointment, if the appointment line's not up, you can't get a hold of us. And so we recognize that, and we learned that lesson, that that's an issue. The winter before, we did not have that issue because we really didn't have any weather. But this year, we recognize that, and so that's a contract that we're trying to change to modify, so again, we can make sure that they can come in and support us, all right? Last thing I want to talk about on this slide is the feedback. So if you come into our appointments and you get sent what's called a Joe survey, and it's our patient feedback survey, I realize it's pretty long. I did not design the form. That is a joint product for all services. But if you can take the time to fill that out, that helps us because I do read every single one of those. I know many of my staff read all of those. And those are just another way that you can provide feedback to us outside the town hall and some other initiatives. We read those, we look at those, and if we can improve our operations because of the feedback that you give us through that, we do take those seriously. All right, next slide. Okay, so a couple things we do have. If you're not involved and would like to get into our patient engagement focus groups, we do have focus groups that we ask you, and we have a group of folks that come in, and they actually help us to improve our operations. And these are a couple of things that they've already helped us out with. Most recently, we did wayfinding. So we're gathering the information, but that was their most recent. And what does that mean? That means as you navigate our hospital, that you can find where you need to go. And we actually walked the patients around, asked them some pointed questions. They gave, lists and lists of ideas of things that we can improve. We're going to consolidate that. And again, we're trying to listen to you, and we value your feedback. And you can see there's quite a few other things. Hearing aid, if you don't know, we do have a hearing aid program. We got the patients involved with that and how we can improve that. And we do have a hearing aid program at the medical group. So we're open to ideas. I know you've got a survey that you can fill out. So anything that we can improve for these focus groups or some other things, we want to hear from you because we turn around and ask those people. And if you want to get involved, I know it's hard to read on this slide, but we can provide that information to you. If you want to be a volunteer at the end of the thing, Cindy Anderson and Major Shindeli's in the back of the room as well are part of our POCs for that. And so if you want to be involved in your health care, more of an active engagement role in helping us to improve so that we can provide those services to you, that's a way to do that. All right, next slide. The only thing I want to update, instead of bringing on my physical therapist here, I'm a physical therapist by background, so I do go see patients in physical therapy. I do not make a dent in the patient load they see there, but unfortunately our physical therapy services we're going to have to scale back over the summer. I am going to be basically down to 2 therapists. So I've got one that's deployed right now overseas. I have one that's going to be leaving this summer. So for those of you that you are currently in physical therapy, or when you come in and you need physical therapy services right now, unfortunately, we're going to have to refer you downtown because we're going to go down to active duty only. For our active duty members, if you're not aware, if you've had an acute injury, you do not actually need a referral to come to physical therapy. You can refer yourself, okay? So they have that privilege to do direct access. So again, I apologize. We're going to try to take care of our inpatient and our active duty. But unfortunately, if we have space available, we'll try to see a couple more than that. But I think really when I'm down to 2 out of 5 therapists, I can't accommodate everybody.
Good morning, everyone. I'm Colonel Guest. I'm the Medical Director of Family Health. I'd like to take a few minutes to talk about some changes in family health. And these are the topics that I'm going to talk about. Next slide, please. Our new clinic hours, 7:30 to 4:30. We've shifted that way so we can extend later appointments to patients. Before, we used to finish clinic around 3:30 to 4, but now we'll be able to see some later patients in the afternoon. We're offering some different appointment types. We still have our typical face-to-face appointments, but in order to improve access, we're going to be offering virtual appointments. So with the virtual appointments, it can be over the phone. So for virtual appointments, we can do that over the phone or through secure messaging. We can't do emails because it's not secure. So if you want to send us a quick message and you have a Relay Health account, then you can send us a secure message. So that can be for requesting appointments. It can also be for refills of medications or even symptomatic complaints. Our office manager, Tim, is in the back. So for anyone that doesn't have a secure messaging account, he can help you get that set up. For phone appointments, there are a lot of things that we can take care of over the phone. I know that everybody is used to traditional appointments, but sometimes you don't want to have to drive a long way just to get a refill of one prescription maybe. So we can always check your labs, make sure that you have the appropriate labs, and if you don't have any refills, let's say it was, you needed your thyroid medication and you've had your lab work done. Even if you haven't, we can order the lab work, check the results, and if you've been on the same dose, say you're stable for 2 years, you don't actually have to come by to have, us just say the same thing we would say over the phone. So we can save you a trip, and we can also get you in earlier by doing that. So a lot of times in family health, the access, you have to wait 3 or 4 weeks to get an appointment. But if we're constantly looking at our schedule, so if we see something simple on the schedule, we can call you up and say, would you like us to take care of this over the phone? And we can go through all of that information, get the refill done over the phone, and save you a visit. And so we're also implementing a new process called Reset. It's helping us with improving access. So the first thing that we did was to make sure that everyone has their own PCM. Before, we used to do a lot of cross coverage, and sometimes if your provider was deployed or out for a period of time, you may bounce around to different providers trying to take care of issues. So what we've done is make sure that there's a assigned provider for each patient, and that provider will take care of that specific panel of patients and a designated additional panel if a member is deployed or their provider is deployed. So that way it allows for continuity. You'll always be able to talk to the same provider team, and we feel that that will improve safety and minimize any errors with a lot of people having to cross cover. Also, we talked about the virtual appointments that will improve access. We started this about a month ago, and we've already noticed some improvement. Where it used to take about 4 weeks to get an appointment, now it's down to 3 weeks. And that's a significant improvement for the size clinic that we have. I mentioned that your problems can be addressed sooner. Now the appointment line is also scheduling virtual appointments starting this week. So what they'll do is if you call in for an appointment, they'll tell you when the next available appointment with your PCM is, and they'll also offer you a virtual appointment. So they won't schedule it unless you say that that's what you want. So they could say the next appointment with Dr. Guest is on the 23rd of April, but I have a virtual appointment available tomorrow. So if you say yes, you would want the virtual appointment, they will schedule you at a specific time, and usually within 15 minutes before or 15 minutes after, the provider will call you to see what your concerns are. It doesn't mean that all of the issues would necessarily be able to be addressed. So let's say, for example, you have knee pain and you want to be seen for that, but you ask for a virtual appointment with the provider. So at a certain time, I would call you up, ask you all about the knee pain, get all of that information. The only difference would be that the technician wouldn't be getting your vitals at that point. And then if we need to see you, we'll schedule a convenient time for your schedule. So I could say, okay, this afternoon I call you at 1:30. You have knee pain. Okay, I'm gonna do a knee exam. I'll say, can you come in tomorrow for a quick visit, and we'll figure out the time, and then we can get that taken care of. So instead of you waiting 2 or 3 weeks to come in for the whole thing, we can do part of it over the phone and then do what we call a priority access visit and schedule it at your convenience, and we can typically do that within a few days. So I think that's really going to be very helpful. It's a little bit of a different mindset, different way of doing things from how we used to, but it will definitely improve access and help to take care of problems sooner. And then Tricare Online is available to everyone. For normal results, you'll be able to see those typically within 4 days after the labs are done and certified. Those results will be available. But of course, if it's anything abnormal, it would still be the old process of giving you a call to discuss that. But if they're all normal, they're available online. Next. And then with secure messaging, we're asking that as many patients get signed up as possible. It really does provide faster access to us, and it's secure. These are some of the benefits of secure messaging. We can actually do some web visits completely through secure messaging. We can send you a template. Let's say you have a concern about allergies. We can send you the allergy template. You can fill out the information, and we can respond and get everything taken care of through a web visit. You don't have to use the appointment line. You can request refills, and also you get your results promptly.
Good morning. My name is Doug Bonner. I work with Humana Military, which is the contractor now for Tricare, and that changed at the beginning of the year. So we'll be going into just some overview of some of the changes that have taken place since the first of the year. So the administration of the Tricare benefit transitioned from a fiscal year, meaning October to September, to a calendar year, January to December. So like for your enrollments and different things like that, instead of everything having to take place at the end of September, 1st of October, now it's going from calendar year January to December. Also on January 1st, Tricare Select replaced the Tricare Standard and Tricare Extra health plans. Tricare Select acts as a preferred provider organization or a PPO style plan. It's going to be very similar to what the Standard and Extra was. It's just called Tricare Select, and that does require an enrollment, that it's not going to be automatic. You would have to enroll in the Tricare Select if that's something that you choose. All beneficiaries other than the active duty service members and the Tricare for Life beneficiaries must enroll in either Tricare Prime or Tricare Select. There has not been any changes to Tricare for Life, so if that's your plan, then all of that has remained the same. So you have to be enrolled in either the Tricare Prime or the Tricare Select to be covered for civilian care, and this also includes newborns, newly adopted children, and children placed as beneficiaries as wards. So, beneficiaries may enroll and disenroll in Tricare health plans at any time between January 1st of this year, 2018, through December 31st of 2018. And eligible beneficiaries must be enrolled in DEERS to enroll in Tricare Prime or Tricare Select. And it is important in DEERS that you keep your information up to date, your phone number, address, things like that, so we can make sure that we can contact you for certain things. Also beginning on January 1st, beneficiaries that choose to switch between Tricare Prime, this is January 1st of 2019, beneficiaries that choose to switch between Tricare Prime and Tricare Select must do so only during an open enrollment period, which will be in usually the first full week in November through the second full week of December, or within 90 days of a qualifying life event, such as a marriage, a divorce, childbirth, if you move, things like that. That would give you an opportunity to make changes to your plan at that period. Non-payment of enrollment fees. If your Tricare plan enrollment fees are not paid when due, then you could be disenrolled from that plan, and then you'll have 90 days from the day you were disenrolled to pay in full any missed payments without a break in coverage. And if you do not make restitution within the 90 days, you can still re-enroll, but you'll have a break in coverage from the time after that 90-day period until such time as you actually re-enroll. So you would want to make sure that you take care of that as soon as possible. Any change in a sponsor status, from example, active duty to retirement, that will also cause an automatic disenrollment from the current plan. So you would need to make a choice at that time as to if you want to continue in Prime or into Tricare Select. If you're still eligible, then after the status change, then you can re-enroll. If you choose not to enroll in a Tricare plan, then you'll only be able to receive care at military hospitals and clinics on a space available basis, or what's called direct care only, and civilian care will not be authorized. So you have to be in one of the two plans, or Tricare for Life. Tricare Retiree Dental Program, this is something that's going to be changing starting in December. If you haven't received already everything, the Dental and Vision Program. Beginning in 2019, dental and vision plans will be available through the Office of Personnel Management's Federal Dental and Vision Insurance Program, or what's called FedVIP. Vision, eligible Tricare beneficiaries will have 4 vision plans to choose from, which would also include coverage for lenses and frames. Dental, the FedVIP Dental will replace the current Tricare Retiree Dental Program. So if you currently have the TRDP, you'll need to enroll in the FedVIP Dental to continue to have coverage in 2019. And if you're eligible, the first opportunity to enroll in the FedVIP is during the 2018 open season, which would be in that November-December timeframe. Coverage will start on January 1st of 2019, and for more details on the new coverage options, you can visit tricare.benfeds.com, and in there you can sign up for email updates as well to get more information on that. And more information will be coming to you through mail and other means as that gets closer as well. Now that we are under Humana Military, you do have the option of going to humanamilitary.com, and you can log on. If you click, when you go to humanamilitary.com, if you click on Beneficiary at the top, and then that will take you to another screen that will give you different options that you can go through to check on your enrollment, on claim status, on your referrals. But you can also click down here on self-service, and that will give you more of a secured login type thing, and you can log in with either your humanamilitary.com password, or if you have a DS logon, you can do that as well. And you can manage all of your healthcare there just as like you would on Tricare Online.
Good morning, everybody. I'm Colonel Monroe. I'm the Pharmacy Flight Commander. Just wanted to go over a few changes with you. Hopefully you've noticed at the atrium our waiting times have they've stabilized. They've become a little bit more consistent in recent months, and this corresponds with our improved staffing. So we're really happy about that. But of course we still have periods during the day where our wait times go up a little bit, and that corresponds with our clinic appointments when they see the most patients. And those busier times of the day are between 10 o'clock in the morning to 11 o'clock in the morning, and then mid-afternoon between 2 o'clock and 3 p.m. So if you want to get faster service, more efficient service, please try to visit the pharmacy during those times, or before or after those times, excuse me. And then of course at the Kitty Hawk Pharmacy, the Kitty Hawk still is a little bit busier later in the week. Many patients choose to come later in the week to pick up their refills. So if you do come early in the week, chances are you'll get a little bit faster service over there at the Kitty Hawk. And of course on days when it's not snowing or raining and the sun is shining, there it's the Kitty Hawk is a little bit busy on the busier on the fair weather days. And I'd want to mention one other thing about the Kitty Hawk Pharmacy. You may have noticed that sometimes we will adjust our refill pickup times. We don't like to do that very often. We don't want to frustrate our patients, but we will adjust them on occasion because our robotic system over there, it's had a few software glitches, it's had a few connection issues lately, so we've adjusted those refill pickup times just to accommodate and make sure that we can get those bugs worked out and process those refill prescriptions safely. Okay, electronic prescriptions are also known as e-prescriptions. This is our prescriptions that are sent electronically from civilian doctors to our providers. We've never really actively promoted that service because in the past the Defense Department has had a few connection issues between civilian doctors and our pharmacy, but a lot of those bugs have been worked out, and with our improved staffing, we've been able to take some steps to actually reduce the number of steps that are required before you check in. So the bottom line is, on those e-prescriptions, we can process those more efficiently. Now, we're really, really happy about that. So please go back to your providers and recommend that they send those prescriptions to us electronically. If we're able to increase the number of e-scripts to our pharmacy and reduce the number of paper prescriptions, we will once again be able to operate much more efficiently. And then finally, in recent months, we've offered our patients the option to check in at the Atrium Pharmacy and then leave. This is something that we've offered once patients have checked in, but we hope in the coming weeks that we'll actually have a button to give patients that option. So if you want to check in at the Atrium Pharmacy and leave, the prescriptions will be ready for you when you return in 2 hours. So that's a good service as well. Yes, the satellite pharmacy, the new Kitty Hawk Pharmacy, it's scheduled to be completed and turned over to the government at the beginning of 2019, and then the opening date, the ribbon cutting date, that's still in the works, but the completion date will be beginning of January 2019.